Taking care of your blood pressure is essential for maintaining good heart health and prevent conditions like hypertension, stroke, and heart disease. Here are some key strategies to manage and control your blood pressure. Hello everyone. Welcome back to Ifechi Health and Wellness. Today, I want us to look at some strategies to manage high blood pressure because there's increase in people going around with high blood pressure. Most people don't check their blood pressure. They may have symptoms that may suggest that they have high blood pressure, but they will not bother to go and check things out. In my next video, I'm going to sort of list some likely signs and symptoms that you may have high blood pressure. Those symptoms may be similar to other conditions, but I'll do that in my next video. But today, I just want to share some strategies with us. These are something we already know, but I think we just need to keep reiterating these things because we are living in a very fast-paced, busy world, and people pursue other things but neglect their health, which should be the priority. Because if you don't have your health, if you are not healthy, if you're not alive, you cannot enjoy any of the things that you are struggling for. So number one is to maintain a healthy diet. Eat more fruits, vegetables, whole grains, and lean proteins. Reduce salt, sodium intake. A lot of the food we eat, especially fast food, all these things we go and grab from the fast food, shawarma, burgers, McDonald's, KFC, all those things are loaded. They are fast food and they're loaded with such sodium, high salt. They have high salt. And avoid processed food and fast food. I just mentioned that. So avoid those things because they are not good for us. Maybe once in a while as a treat, but not something you have to be having all the time. Try and consume food that are rich in potassium, such as bananas, spinach, sweet potatoes, because they help to counteract sodium effects. Number two, stay physically active. Engage in at least 150 minutes of moderate exercise. Example, walking, swimming, or 75 minutes of vigorous exercises. Example, running, cycling. I'm talking about per week. I'm not saying you 150 minutes every day, at least per week. And I mean, I go well over this because my exercise and being active is a priority for me, and it should really be for everyone. The next one is maintain a healthy weight. Losing even 5 to 10% of body weight can significantly reduce high blood pressure. So monitor your BMI and waist circumference to stay within a healthy range. BMI should be low. Once it gets to 30 and above, there's a concern. So it should really be much lower than 30. It should be in the 20s for most adults. But once you have, and it's easy to calculate your BMI, check your height and your weight. That's two of them combined. Then you can now, if you put it in the app, it will tell you, once you put your weight and your height, it will calculate it for you to know your BMI. And your BMI ideally should be below 30. Yeah, some people even say about 25, but I generally say below 30 so that you don't get into too much hassle trying to stress yourself too much, because in the process of trying to lose weight, you're stressing yourself. Is not good. And that brings me to my next point, which is number 4, is managing your stress. Practice relaxation techniques like deep breathing, meditation, or yoga, and engage in hobbies and activities that can help you to relax and get adequate sleep. Lack of sleep, again, is a big issue for most people these days because of these gadgets that we have. Sometimes we are so tempted to be on our gadgets till late in the night. And when you are looking at the screen or looking at your phone or any kind of gadget late in the night before you go to sleep, then it can actually affect your sleep. So try and get adequate sleep, 7 to 9 hours per night. I know that's pushing it, but if you're able to even get 6, most adults, if they get straight 6 7 hours sleep, that should be enough. The next thing on my list is to limit your alcohol and caffeine intake. If you drink alcohol, limit it to one or two times a week, or here in the UK they talk about units or pints, things like that. So limit it to 1 or 2 pints or limit of alcohol per day. That's you just have to go by your own. What if you are drinking too much, you will know. So there's no need, even saying this number or that number. Just everything in moderation. That's what I say. And be mindful of your caffeine intake, because it can temporarily raise your blood pressure in some people when you have a lot of all these drinks. What do you call it? Coke, Fanta, Sprite, all those things, and coffee and stuff like that, and tea. They all have caffeine. So try and be moderate with those, just to make sure, because they can actually raise your blood pressure. Another thing on my list is to quit smoking. If you do smoke, quit smoking, because it's not good, it can raise your blood pressure. And also monitor your blood pressure regularly. If you use a home blood pressure monitor to track any changes in your blood pressure, and once in a while see your GP or see your doctor to check for regular checkups of your blood pressure. Most people, you ask them what's your blood pressure, they are like, oh, I haven't checked it for years, and that's not good. That's not good at all. We have to keep an eye on our blood pressure to make sure, because some people will have very high blood pressure, they'll be walking around without knowing. And if you are already diagnosed with hypertension, high blood pressure, and you're prescribed medication, please take your medication as instructed by your doctor. Don't think, oh, today my blood pressure was good, so I won't take my medication. That is abuse of medication, really. So try and take your medication as prescribed, and never stop taking it without consulting your doctor. Okay, so I'm going to stop here. And by following these steps, you can maintain a healthy blood pressure and reduce the risk of cardiovascular disease. Thank you so much for listening, and I hope you have benefited from 1 or 2 things from this video. Goodbye and God bless. Next time I'll come around, I'll bring something like signs and symptoms or things to look out for, and which may suggest that your blood pressure is raised. So I'll stop this one here. I don't want it to be too long. Goodbye, everyone.